Alberta Health Services. Healthy Albertans, healthy communities, together.
Good morning, everyone. I'm David Wyatt, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you for taking the time to dial in and join us. This will be a short meeting as we only have 5 motions from 2 committees to consider. Further, there is nothing more important to this organization than the health of Albertans, and I do not want our meetings to take the focus of the staff off of that critical mission at this time of pandemic, increased workload, and potential staff shortages due to illness and quarantine. On that note, I would quickly like to acknowledge the extraordinary work of thousands and thousands of staff and physicians who are responding to this crisis. On behalf of the board, I commend you for your extraordinary work. And if I may be so bold as to speak on behalf of Albertans, I thank you from all of us as well. We're truly grateful and comforted in knowing that we are in your capable hands. Now on to the business of the meeting. We are participating by telephone conference today. When I ask for a vote on a motion, I will ask for those in favor, and then I will ask for those opposed or abstaining. If there are none in the latter group, I will declare the motion passed. I ask that someone move for approval of the agenda.
Hugh.
Heidi. Thank you. Thank you, Heidi. Any further discussion? All in favor?
Aye.
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 Any opposed or abstentions? The motion is passed. Thank you. Based on the approved agenda, do any board members have a conflict of interest they would like to declare at this time? Hearing none, we will move on to the motions recommended by our board committees. David Carpenter, Chair of the Finance Committee.
Thank you, Mr. Chair. The Finance Committee met on March the 11th, 2020. As Chair of the Finance Committee of the Board, I'm presenting 3 motions for consideration today. First, the committee considered an authorization to spend for AHS from April 1st, 2020 to June 30th, 2020. The committee reviewed a request to approve an authorization to spend as the 2020-2021 budget for AHS will not be approved by the Minister of Health by April 1st, 2020. The AHS Health and Business Plan, which includes the 2020-2021 budget, will be submitted to the Minister for approval after the 100-day implementation plan for the AHS review is submitted, and an estimate of cost for the COVID-19 pandemic for 2020-2021 is available. This request for authorization to spend in absence of an approved budget is in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments Policy, which provides that it be supported by written confirmation from the Minister's Office specifying the interim period, the amount of funding to be provided, and the amount that AHS is authorized to spend during that period. The committee recommended that the board approve the authorization for expenses, and the board has considered such recommendation, and the members support its approval. Accordingly, I move that the Alberta Health Services Board authorize AHS to incur, firstly, maximum expenses of $3.975 billion for the period April 1, 2020 to June 30th, 2020, and secondly, maximum capital expenditures of $150 million for the period April 1, 2020 to June 30th, 2020. I so move.
Thank you, David. May I have a seconder?
Brian.
Thank you. Any further discussion? All in favor?
Aye.
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 Any opposed or abstentions? The motion is carried. David, your next motion.
Next, the committee considered for recommendation of board approval of 2020-2021 preliminary funding arrangements for Covenant Health, the AHS wholly owned subsidiaries, Alberta Precision Laboratories Ltd., Capital Care Group Inc., and Care West, and the Saskatchewan Health Authority. The board will first address the preliminary acute care funding arrangements for Covenant Health. Preliminary and final funding is communicated to Covenant Health in funding letters. The committee considered for recommendation of board approval preliminary funding for 2020-2021 based on 2019-2020 funding. The preliminary funding exceeds the CEO's limits per Policy 1100, Delegation of Authority and Establishment of Controls for Commitments Policy, and accordingly requires board approval. The committee recommended the board approve the proposed preliminary acute care funding for Covenant Health for 2020-2021. The board considered the same, and members support the approval accordingly. I move that Alberta Health Services Board firstly approve the preliminary annual 2020-2021 Covenant Health acute care funding on the terms reviewed by the Finance Committee and the Board, and secondly, delegate authority to the AHS President and CEO to sign the required payment requisitions based on the preliminary maximum amount and adjust as the final funding amount is determined. I so move.
Thank you, David. Will someone second the motion?
I'll second it, please, Mandel. Doesn't matter.
Thank you. Any further discussion? All in favor?
Aye.
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 Any opposed or abstentions? The motion is passed. David?
The committee also considered similar preliminary funding requests for the AHS wholly owned subsidiaries and the Saskatchewan Health Authority. The committee was advised that the identified preliminary annual funding amounts will be subject to further adjustments as savings initiatives, activity, and other factors are determined to arrive at the final funding amounts for 2020-2021. The committee recommended the board approve the preliminary funding. The board considered the same, and members support the approval. Accordingly, I move that the Alberta Health Services Board firstly approve the preliminary annual 2020-2021 annual funding to AHS's wholly owned subsidiaries and to Saskatchewan Health Authority in the amounts and on the terms reviewed by the Finance Committee and the Board, and secondly, delegate signing authority to the AHS President and CEO to sign the payment requisitions or revenue transfer journal entries for such funding. I so move.
Thank you. Seconder?
Second.
Thank you. Any further discussion? All in favor?
Aye.
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 Aye. Any opposed or abstentions? The motion is passed. David, thank you for that committee report and for bringing those motions forward. Next, I will call on Glenda for her as chair of the Quality and Safety Committee for her report and motions.
Thank you. The Quality and Safety Committee met on March 11th, 2020, and the committee's meetings focused on access, quality, and safety. The committee received the 2019-20 Q2 Patient Safety Report, an update on the Alberta Surgical Initiative, and an update on the COVID-19 pandemic. We also received a report on strategic initiatives of the organization with a specific focus on the new home-to-hospital-to-home transitions guideline and measures. As chair of the Quality and Safety Committee, I'm presenting two motions for approval. First, the committee considered for recommendation for approval the Alberta Health Services Accreditation Status and Activities for Health Facilities and Programs Annual Report. Ministerial Directive D5-2008, Mandatory Accreditation in Alberta's Health System, requires AHS to provide information on accreditation activities and outcomes and accreditation status in an annual report to the minister. Accordingly, I move that the Alberta Health Services Board, 1, approve the Alberta Health Services Accreditation Status and Activities for Health Facilities and Programs Annual Report, 2, support the board chair delivering the report to the Minister of Health by March 31st, 2020, and 3, direct management to make the report available on the AHS public website as soon as practical. I so move.
Thank you, Glenda. May I have a seconder?
Thank you.
Ready?
Thank you. Any further discussion? All in favor of the motion?
Aye.
Aye.
Any opposed or abstentions? Thank you. The motion is passed. Glenda, your second motion?
Secondly, the committee considered for recommendation for approval revisions to the Quality Assurance Committee structure. All modifications to the AHS Quality Assurance Committee governance structure require the approval of the AHS board. 4 of the changes are committee and subcommittee name changes to reflect changes to the names of portfolios. The 5th change is to the terms of reference for the Stollery Transport Team Quality Assurance Subcommittee of the Child Health Quality Assurance Improvement and Patient Safety Collaborative Quality Assurance Committee. Given the number of amendments to the names and the terms of reference, the revisions will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly. The last 2 changes relate to standing down of committees. The board has reviewed all amendments. Accordingly, I move that the Alberta Health Services Board approve 1, the name changes to the committees and subcommittees as reviewed by the Board, 2, the changes to the terms of reference of the Stollery Transport Team Quality Assurance Subcommittee of the Child Health Quality Assurance Improvement and Patient Safety Collaborative Quality Assurance Committees, 3, that the Laboratory Services for Public Health Quality Assurance Subcommittee of the Laboratory Services Provincial QAC be stood down, and 4, that the Laboratory Services Genetics Quality Assurance Subcommittee of the Laboratory Services Provincial QAC be stood down. I so move.
Thank you, Glenda. May I have a seconder?
I'll second.
Thank you.
That's Stephen.
Any further discussion? All in favor?
Aye.
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 Any opposed or abstentions? The motion is passed. Glenda, thank you for your committee report and for bringing those motions forward. As we've reached the end of our agenda, I declare the business meeting is adjourned. Thank you again for joining us. Please wash your hands, practice social distancing, and self-isolate as appropriate. And have a good day.
Thank you. Thank you. Bye.
Together, we do amazing things every day.